Welcome again, everybody. We are getting towards the tail end of group presentations. We've got group 9 with us, Teresa, Garrett, and Vinny. And then Teresa and Garrett are the ones that are going to be here presenting. So I'll go ahead and turn the time over to them.
All right, so I'll start. So this is just a preview of kind of what we're going to be going over. Slides 3 through 5 are basically your personal rights and the privacy rule. Slides 6 through 7 are going to be covered and non-covered entities. And then 8 and 9 will be enforcement of HIPAA, 10 portability, and then 11 through 15 COBRA. Next slide, please. So HIPAA, it's the Health Insurance Portability and Accountability Act of 1996. What is its purpose? So I think a lot of us, if we worked in a, or even volunteered in a healthcare facility or a healthcare setting, we've had to do HIPAA training. I've had to do it like 3 times. And a lot of what they cover is primarily personal rights of HIPAA or protecting people's health information. So HIPAA is, like, as the act itself, it is a national standard of keeping records secure for your health, as far as health information goes. It protects your personal rights as far as being able to access your information, who's looked at it, things like that. And it allows for portability of health coverage, and we'll talk about that a little bit later, as far as continuance of health coverage under group health plans. Next slide, please. So your personal rights under HIPAA, you have the right to access your own health records, to correct information, to discuss discrepancies with your health record with your doctor, to know who has seen your health information. So an example of that would be in your doctor's office and kind of saying, so who's seen this? And they could tell you basically who's had access to that record there in the office. And especially with with your e-health information or computerized health information, there's generally like a mark or a computerized signature, if you will, that marks who has seen it, and so on and so forth. So you have a right to know how your health information will be used, and this is generally as far as treating you, how your health record will be shared between doctors, and it's generally for, like I said, treatment in a hospital or at a doctor's office. Next slide. So the privacy rule, this is something that it was issued by the Health and Human Services to protect your information. It's another national standard of protecting your health record. So I'm kind of just going to go through some of these points. It limits the use of the information based on, like it says under here, it says required disclosures and permitted uses and disclosures. So I'm just going to go over a couple of these things. So of course, required disclosures are if you ask for your health record, they have to show it to you or they have to give you a copy of it. Disclosures from the Health and Human Services when investigating complaints or enforcement actions. Permitted uses and disclosures include, like I said before, to the individual, the uses of treatment, payment, and healthcare operations, and research. This is kind of a cool one because a lot of the statistics that we see for things like cancer, things like, heart disease, all these other things, a lot of that is information gathered from people's health records. So that's one of the permitted uses for our health record. An opportunity to agree or object. And from my understanding, this is when a patient primarily is incapacitated, unreachable, in an emergency, and it's basically for professional use in the best care of the patient. Incident to an otherwise permitted use or disclosure, and again, from my understanding, this is kind of an incidental breach. And this isn't going to be like something that's going to be punished, because there's going to be, no matter what you do, there's going to be something happen, or things that happen that someone might see something that they may not have supposed to. But as long as the healthcare organization has safeguards in place to keep that from happening as much as possible, they're good. Public interest and benefit activities. So this has like a ton of stuff that falls under this category. Laws, victims of abuse and violence. This is really important because as healthcare providers, if they see, if they have someone come in who has, or a child that has been abused or show signs of abuse, that needs to be for the best interest of the child or the person. That is, your healthcare record can be used for that. Public health purposes, coroners, funeral directors for autopsies, try to determine cause of death, or for identification purposes, tissue organ donors, workers' comp, oversight audit. So, you know, organizations generally have someone come in and audit their records. That would fall under that category. Government and military, threats to public health and safety. So those are just some of the things that would, and there's more, I didn't read all of them, but there are more that fall under the public interest and benefit activities. Next slide.
That's me. So covered entities, these are entities that must follow HIPAA, and like it says, they're called covered entities. And these include health plans, most healthcare providers, and healthcare clearinghouses. Health plans would be like health insurance companies, health maintenance organizations, company health plans, government programs like Medicare and Medicaid. As under providers, that would include doctors, clinics, hospitals, pharmacies, dentists, chiropractors, etc. And there's a lot of people or organizations or facilities that would be under providers. And it's especially to those who transmit health information electronically. Although not entirely always electronically, that's just a special emphasis is given there. Healthcare clearinghouses are public or private entities, such as billing service or repricing companies, or public health systems that facilitate the processing of health information received from other entities. So this could be like, I thought of this as like middlemen, someone who handles the health, maybe in like the finances between like the doctor and the insurance company, or between you and your insurance and things like that. And those fall under healthcare clearinghouses. Next slide. And these are the ones that are not covered by HIPAA. And I've got a list here. I'll go through them. This is, I guess, specifically the privacy rule, but this life insurers, employers, workers' comp, schools and school districts, agencies like Child Protective Services, law enforcement agencies, and then hybrid entities. And again, these are the ones that don't have to follow privacy rule. A hybrid entity, however, is a little bit different. And it is, a good example I found was like the University of Utah, which is both a school, but it also has a hospital that is tied to it. And so even though it is a single entity as the University of Utah, the university, they can apply to be a hybrid entity where the university would not be covered by HIPAA, but the hospital would. And that can give them more opportunities through education and things like that, where HIPAA isn't so much a block, and it protects them in different ways. So the hospital would be covered and the university would not, even though they are in actuality a single entity, which is a hybrid entity. Next slide. And that's hers. And that is also me. So portability, I found, when I first started researching, I thought it was going to be a lot more complicated than it really is. It's a pretty simple idea, from my own understanding. But it's an employee's ability to keep certain benefits when switching employers. And portability can apply to a lot of things, not just in health, because it could be pension plans, 401ks, or like retirement, things like that. But health insurance is covered under there as well. So as it pertains to healthcare, it means that employers cannot reject a person or their dependents from group health plans because of pre-existing health issues or other health factors. So my understanding is if a father who works for a certain company and his wife and his children are all dependents on his health insurance through his company, and when he changes employers for one company to another, one COBRA applies kind of in the middle, which that'll go over later. But as far as portability, the new employer can't reject them from the opportunity at a group health plan because of maybe a pre-existing health issue from his children or himself or his wife because of portability. HIPAA allows him to keep that health insurance plan from one job to the next, and the next can't stop him from having it. Next slide.
So just really quick, we kind of skipped over the enforcement because that was someone else's part, but we just want to emphasize that violations of HIPAA can result in fines and also jail time. But anyway, moving on to COBRA. So Consolidated Omnibus, I think I'm saying that right, Budget Reconciliation Act of 1985. So what it does is COBRA essentially requires employers that carry group health insurance to allow continuance of that coverage for employees that have been terminated or for some reason have not, do no longer qualify for the terms that are needed to be under that insurance, also known as a qualifying event, and we'll get onto that on the next slide. So next slide, please. So who's eligible for coverage? Employees who, because of work status or termination through employment, are no longer eligible for coverage through employer-provided group health insurance. Now, this does apply except as far as termination. If you're terminated for misconduct, then from what I understand, COBRA does not apply. Same thing, spouses, dependents of a terminated employee or a non-eligible employee through an employer provided group health coverage. Again, so this would apply to children, spouses of employees who qualify under a qualifying event, I guess. Next slide. So qualifying events, death of a covered employee. So if your husband who's working for a company passes away, and he's the one who you have insurance through, yourself and your children, if you're the spouse, would be able to continue health coverage after the employee's death. Termination, like I said before, unless the reason for termination was misconduct or reduction of hours. So if you were a full-time employee and your company requires you to be a full-time employee in order to have group health benefits, then all of a sudden they cut back your hours and you're no longer a full-time employee, then this also gives you the opportunity to continue that coverage even though you no longer qualify because you're only a part-time employee. Divorce or legal separation. So say you divorce your spouse who you have insurance through, you're able to continue that separately after being divorced or separated. Same thing with your children. Becoming entitled to Medicare benefits under Title 18 of the Social Security Act. So this again is something where your spouse, whoever you have insurance through, is now qualified for Medicare. You can continue their previous insurance through COBRA through the employer, from what I understand. Dependent child ceasing to be a dependent, so basically reaching age 26 where you are no longer a dependent, you can still extend coverage. Next slide.
Great job reading Roman numerals, by the way.
Enrolling in payment. So employers have to notify their employees that they have the right to continue this coverage. The notification also lets them know why they are being terminated or why their hours are being cut back and the length of time that they are eligible to extend coverage through COBRA. And it'll also include the amount of the premium payment. The employer has to allow 60 days for the employee to make the decision. And if they do decide to enroll in COBRA, they have to complete the enrollment for themselves and their family or their spouse and dependents. And once they're enrolled, the employee has 45 days to make their first premium payment. The only thing with this is that since they no longer are eligible through the company doesn't pay part of the premium, so you are responsible for the full premium amount plus 2%, plus a 2% administration fee to the employer or the administrator of the plan. Next slide. So how long does COBRA last? And this kind of just depends on the circumstances. It's generally between 18 and 36 months. 18 months for both the individual and dependents in the case of job loss. 36 months if the employee qualifies for Medicare, passes away, divorce, or legal separation. 36 months for dependents who are no longer qualified as dependents once they reach the age of 26. Disability can qualify a person for up to 24 months extension added onto the 18 months if they are qualified or deemed disabled by the Social Security Department. Next slide, please. So these are just our resources. Quite a few, well, a few of them are from the healthandhumanservices.gov. I personally kind of tried to keep it under government websites, but yeah, this is pretty much where we got all of our information.
Okay.
Good to me.
Sorry, let me put the mute on. Feedback. Okay. Great job. I think we will go ahead and forego any questions here and wrap things up. Real quick, one thing that I've always found kind of funny when it comes to HIPAA, and of course there's nothing too funny about HIPAA, but for a while I worked at a nearby hospital here in Utah, and obviously some of the celebrities here in Utah are apostles, prophets, LDS members, authors, that type of stuff. And there was a time where one of the apostles had to spend some time at one of our hospitals, and it was funny because a large amount of people, employees, got in a lot of trouble. Even a few of them got fired for looking up their information on the computer because they knew that that particular person was there and they wanted to find out more information about them. So obviously that's a big no-no. HIPAA violations is a big deal. I kind of joke around that if you ever want to get fired from working at a hospital, one, either look at porn, or two, violate HIPAA. So I'm not going to say that violating HIPAA is as bad as pornography, but it's just something that is taken very seriously within the healthcare world. So you guys did a very good job at illustrating how important it is, all the details that go in with it. So you did a great job, and I'll let you go unless you have any other comments you want to make.
I don't. No.
Oh, okay. I'll take that. I muted you, Teresa. I'm sorry, but I'll take that as a no.
None.
Okay. All right. Well, thank you again, and enjoy the rest of your evening. We'll talk to you guys later.
Thanks, you too.
Bye-bye.